Whenever I'm talking to my patients who are considering spine surgery, I basically tell them the exact same five things. Number one, I cannot predict or guarantee a result. The goal of the surgery is to hopefully improve your condition, but we cannot guarantee that you're going to be 100% better. If you come across a surgeon who gives you a surgical guarantee, do not believe that surgeon. Second, when we do a surgery, we have to give you general anesthesia. General anesthesia, in very rare cases, can cause things like heart attacks, strokes, blood clots, organ failure, and in the worst case scenario, you could even die from those complications. And if you have any significant medical problems, you need to make sure that you have the proper workup before surgery so that it is safe for you to have spine surgery. The third thing is that recovery from a spine surgery takes a long time. For example, if you have a fusion surgery, it can take between 6 to 12 months for the fusion to heal. So you're not going to know how much improvement you're going to get until somewhere between 6 to 12 months after surgery. The fourth thing is that when we're doing spine surgery, we're working next to major blood vessels, arteries, veins, spinal cord, nerves, and you can get an injury to those structures in rare cases. You can get a spinal fluid leak, you can get a wound infection, and if you have any of these complications, you may need to have those problems corrected at later on second surgery. And finally, if you have a spine surgery that has healed successfully, for example, you had a microdiscectomy and the discectomy healed very nicely, there's a possibility, a small possibility, that that disc may herniate at a later point and you may need to have a second surgery. Also, if you have a fusion surgery, like you have a ACDF surgery or lumbar laminectomy and fusion surgery, once the fusion has healed, there's a possibility that the disc above or the disc below that may degenerate at a later point, and you may need to have a second surgery. This is something called adjacent segment degeneration, and this is a well-known phenomenon. If as a patient you have considered all of these factors, you will be able to make a good decision about whether or not surgery is the right answer for you.